Hello, everybody. My name is Dr. Moses Tabe. I'm Billy Chu. I am a board certified psychiatrist here in the United States of America. I practice medicine in the hospitals and in the community, dealing mostly with patients who are mentally ill. We've decided to create a series of videos to help educate patients around the world and here in the United States about the different types of mental illness, because we believe that an educated patient is a better patient. When family members understand a lot about mental illnesses, they are more likely to decipher or discover when something is wrong with any of the family members and seek help. So we believe these videos are extremely important in reducing the stigma of mental illness and reducing the burden of disease. So today I'm extremely excited to talk to you about a very important disease entity called major depressive disorder. What are the symptoms of major depressive disorder? Well, patients with major depressive disorder present with depressed mood. It's similar to sadness, but extreme deep sadness, very intense sadness. Patients may also present with a symptom called anhedonia that refers to a loss of interest or pleasure in activities that patients typically enjoy. For example, playing football or soccer or tennis, the patient may find out that they don't have as much interest in executing that activity. Concentration and cognitive performance may be impacted as well. Energy levels are typically low. Patients may wake up in the morning feeling already tired without doing any serious amount of work. Appetite is reduced in most patients, but may be increased in other patients. Patients report problems with sleep. It could be initial insomnia, so problems at when you're trying to fall asleep, it takes some time before you can actually fall asleep, or they may be waking up early. In the morning, they usually feel very tired. In serious cases, patients may start having thoughts of wanting to harm themselves, what we call suicidal ideations. In that case, the patient requires hospitalization for medically necessary treatment. Patients may also have hallucinations. Hallucinations are kind of perceptual disturbances that could originate within the patient's head or external to the patient's head. They could hear things like voices saying you're not good, you're bad, go ahead and kill yourself. In that scenario, the patients must be hospitalized or seek immediate medical attention. Why is it important that we talk about major depressive disorder? Well, major depressive disorder is extremely important because it has a high burden of disability for patients worldwide. Millions of patients are affected. Without treatment, these patients have significant problems in occupational, social, and other areas of functioning. Now, how does the doctor go about diagnosing and treating major depressive disorder? When patients come to me, a physician like me would take a history and do a physical exam or a mental status exam. So you would ask questions about when did the problem started, what symptoms, how the symptoms have evolved over time, and you would make a diagnostic conclusion. Typically, we would order labs to make sure the patient doesn't have problems with other areas of their body that could impact their mood, such as the thyroid, such as other areas like sex hormones, their blood sugar, hemoglobin. We'll check all of that to make sure we're not dealing with any condition that is, a general medical condition that is impacting the patient's mood. Once our a diagnostic workup is complete, we would attribute a set of differential diagnoses, and we would do a treatment plan. Treatment plan usually involves prescribing medications. Typically for depression, there are medications called SSRIs, which is selective serotonin reuptake inhibitors, but there are other ones like bupropion, which we will talk about a little later in subsequent videos. My colleague at the hospital will handle that part, and we'll talk about pharmacological treatment for depression in quite some detail. Another colleague of mine will talk about psychotherapy, because psychotherapy is also an important part of the treatment for depression. She will go into details of what kinds and what types of psychotherapies are extremely effective in the treatment of depression. Other things are important: exercise, eating right, holistic approach such as prayer and fasting and all that kind of stuff is extremely important. So in the next videos, we will be developing more on this foundation that I've just created. And please do not forget to share the video with your friends and family, educate them if you understand better. Like, share, subscribe to our channel, Worldwide Psychiatry channel, as we will be bringing you a series of videos explaining each and every mental disorder that we are aware of. Thank you for listening. Have a great day.